Hi guys, welcome to PlaySafe episode 4. Today we will be going over ankle sprains and injuries, and I'm going to be talking about the definition, anatomy, MOI, symptoms, emergency treatment and prevention, and many more in this video. So let's get to it. So first of all, what is an ankle sprain? So the ankle sprain, an ankle injury or sprain, is the tearing of the strong ligaments in the ankle. So there are three in the front of your ankle, and there's one behind the ankle, so total 4. So these are the posterior ligament, the calcaneal ligament, the anterior ligament, and the deltoid ligament. So I'll have like a picture showing them. So back to the definition, the tearing of the strong ligaments, these 4 ligaments that support the ankle, and they stretch beyond their normal limits. So that's what causes the tear in the ligament, and it's called a sprain. Ankle injuries are actually the number one reason why people miss participation in sports, and so this is actually a pretty big injury, and that's pretty common. About like 90% of ankle injuries involve the inversion of the foot. So if this is your foot, this is inversion if you were to twist your ankle like that, and this is eversion going out. So it's, yeah, I'll have a diagram showing. So what are the causes of this injury? So walking, working, or exercising on a uneven surface. So like if you're walking down a sidewalk that's like uneven, you could twist your ankle. If you're running in baseball and like the dirt could be uneven, then that's another injury. The plates are uneven to the ground. Falling down and tripping is another reason you could twist your ankle. Jumping, cutting, or different kinds of fast movements in sports with your feet, those could also cause injuries, and especially jumping wrong and landing wrong. So risk factors include poor balance, loose or flexible ligaments, so that is very dangerous. You always want to work on strengthening your ligaments. Alignments in your ligaments, wearing too big of shoes, those could really cause ankle injuries. You really want to get perfectly sized shoes. Shoes with slippery soles, and then if you had an ankle sprain before, the likelihood of you getting another one increases a lot too. So what are the symptoms of ankle injuries? So when you feel pain when you are resting your ankle, that is a symptom you will have. Swelling and bruising in the ankle, and then just instability, trouble walking. I'm actually a victim of ankle sprain. Like I sprained my ankle in 3rd grade, and I was like in crutches for like 1 month, from playing baseball. So, and then if you go to a doctor or like a physician or physical therapist, they will observe your ankle by, comparing it to your other ankle, palpating it, range of motion testing, and stability testing. X-rays, stress X-rays, and MRIs are some like emergency, very dangerous level checkups on ankle. If you're feeling a lot of pain that's not recovering. So what is the emergency treatment of ankle injuries? So the minute you twist your ankle, you want to immediately stop the activity, get out. If you're in the sport, you want to rest, protect the ankle so no more injury happens to it. Don't do anything else, any more force. And then ice to reduce the swelling. Secondly, weight bearing exercises after like a couple days or weeks. Don't quote me on that. I'm not too sure. But yeah, weight bearing exercises after the injury are good for recovery. If you get a grade 2 strain, which is like partial tears, like pretty partial tears in the ligament, then a brace, a walking boot, really help, along with crutches for walking. And then for grade 3, which is like a very severe tear in the ligament, then that would be a leg cast or braced for 10 to 14 days minimum. Yeah, and I'm basing this off scientific research, which I'll have in the description afterwards. So yeah, treatment would be just a period of immobilization, just completely stop and just rest the ankle and ice. Weight bearing exercises, the walking boot and brace, kind of the emergency treatment, but the same thing. Emergency treatment is kind of similar to normal treatment. Surgery on your ankle would be two things. This is kind of similar to the ACL injury video I went over and the surgery in there. So there would be arthroscopy, which is stitches on the ligament and small incisions to just repair it. And then open or repair reconstruction would be a tissue graft and just replacing the ligament with another one. And then yeah, recovery would be immobilization again, and then rehabilitation with weight bearing exercises, just gradually trying to get that ankle back to its strength. So finally, let's go over prevention. Prevention would be to have good muscle strength in your foot. Try to, always work on ankle exercises, running exercises, balance and flexibility. You always want to just keep that ankle strong, because there really is no way to prevent ankle injuries. It's just how much you take care of your ankle and just strengthen those muscles. That's really the only prevention. And then some good prevention things are also to always warm up before exercises or activity. So yeah. And then yeah, strengthening exercises really help. So weight bearing, resistance bands, all that stuff. I actually had to do some resistant band exercises when I twisted my ankle, and I'm also flat-footed, so those are two bad things. Another big thing is for recovery, the return to play, is PAASS, which stands for Pain Ankle Athlete Sensorometer and Sport Performance. So what these each stand for is pain is during sport, you want to check the pain of the ankle during your sport and over the 24 hours of the injury. Ankle impairment, so this would be checking your motion, strength, endurance, and power. So yeah, just the overall evaluation of the ankle. Athlete perception, which is how the athlete is feeling about the ankle and how they feel, going out to play, and their performance, how they feel, like if they will feel like they are still in pain and stuff like that. Your sensorometer is basically the balance and body control you have. So it's kind of still evaluating the ankle for performance. And then finally, sport performance is basically how they perform during sports and exercises. So those 5 PAASS is what you should know for return to play. If there's anything else to go over, just know that ankle sprains are really common, and they they are hard to prevent. You could get knocked over and twist your ankle. It's very, very shaky. So always wear, you know, proper soles, proper shoes that fit you. Always strengthen your ankles, ankle muscles and ligaments. Always do exercises. And yeah, with that, you should be good to go. Thank you so much for watching this video. This is PlaySafe. We help you, you know, with prevention and injuries, to prevent injuries. And so I'll catch you in the next one.